Jay, and with me today is Dr. Sharan. We are going to be talking. Why do I sound so formal?
I don't
Like this is
know.
some kind of TED talk like that. No. Okay. So hello everybody. Yes, my name is Kavin Jay, and with me today is Dr. Sharan, and with Accent Wellness, we are trying to do something that is a bit different lah. It's called "Don't Be Embarrassed" lah. Mythbusters, things that men think is not important. Now, Dr. Sharan, maybe you want to introduce yourself a little bit, like tell us, a little bit about you lah.
Very good morning, Kevin. Thank you. Thank you very much. Thank you, Accent Wellness, for putting me back in this again. Well, what I do is I do preventive medicine, where we integrate holistic approach, wellness approach, anti-aging approach, and we look at rebalancing hormone levels where one has got reduced levels or maybe too much, and we incorporate lifestyle modifications on your diet, your exercise, and your supplements. We run a clinic in Subang Jaya, and I've been doing this for the past 8 years, 20 years experience as a doctor, and I work very closely with Accent Wellness for my hormone needs.
Okay.
Back to you,
Just to put it out there, I am not a patient of Dr. Sharan, as you can see.
Not yet.
Not yet. I don't. Well, we'll see. We'll see how this goes today, and then we'll find out. Okay. But however, no, I'm not saying anything. But however, we need to quell some myths out there. Like there's a lot of myths. Like my family, especially my mother, my father, my aunties, my uncles, my cousins, they all got some sort of medical degree. Right? Every day they will come and tell me stuff. Like if you start sneezing, suddenly they say, "Oh no, cold water makes you sick."
Right? I think all families have that. All families have doctors. I mean, degrees and with degrees.
I know. Was it hard for you, Dr. Sharan, to grow up as a doctor in an Indian family where everybody thinks they're doctors?
Oh, I must say, it has been difficult. It's still difficult. I get calls saying, "Oh, don't you think you need to do this? Don't you think you need to do that?" And I'm like, "I'll just leave it to us, lah. Please leave it to us."
Exactly, right?
Difficult.
You went through You went to a medical school for a lot of years. I'm assuming.
6 years.
6 years, and then on top of that, then you have to do specialists, and then all sorts of nonsense. So years and years and years of training. But this uncle, who basically is a mechanic somewhere, thinks that he knows better than you. It's difficult, isn't it?
It is very difficult. So then I just throw out some scientific research, some literature, some journals, and that probably will, close them up for a while lah.
For a while until the next family gathering.
Yes.
After the next family gathering, it all comes back. But however, we're here to bust some myths, and I've taken the liberty of writing down some myths that I've heard lah. This is of course based on men's health, because it's November.
We're talking only about men today.
Yes, because it's November lah. I am constantly in November mode, so that's how it happens. This is for my mom actually. My mom is very hairy. So first one, we start strong. Okay, we start strong. We start with masturbation. We start with masturbation.
Okay.
Don't be embarrassed. Not embarrassed. That's not for you. That's for me.
Big stigma in Asia, especially to talk about it. But we have to understand that masturbation is a normal physical function, just like how you breathe air, just like how you go to the bathroom. It is normal. In fact, there are journals done in pediatric journals from JAMA saying that children at the age of 14 to 17, 74% of boys during puberty masturbate, and about 48% of girls actually masturbate. But then again, very stigmatizing in Malaysia or any Asian country. We have the orthodox parents, and we also have the religious components to it. But I would say, as a doctor here, because that is my profession right now, it is still a stigma, which has led to a lot of misinformation and numerous masturbation myths. So maybe we want to go with that now.
Yes, we will. Okay, the first one, I remember this very well when I was a kid. Everybody tells you this, okay? Masturbation, too much masturbation makes you go blind.
the male genitalia got to do with the eyes?
I have no idea. This is the things that people tell you. If you masturbate too much, you will go blind. And if you notice, I don't wear glasses.
Got good eyesight here, huh?
Yeah, very good eyesight. I'm 2020.
Mine is genetics, okay? My eyesight is genetics.
Actually, I didn't even notice that. Sorry.
Oh.
But no, the thing is, I'm just saying that I as a non-medical person can tell you this is not true because I got 20/20 vision, and God knows I've been very active in the choking the monkey stage.
Oh, wow. Okay. So, yeah, in reality, there are a lot of myths about masturbation. It can cause hairy palms. Have you ever heard of that one?
Yes.
Yeah. It can cause insanity. It can cause tuberculosis, and it can also cause blindness. No, that is just a myth. See, the thing is, people from back days, the old eras, they believe that sex was only for procreation.
Okay.
So to them, it was taboo to masturbate. Yeah. So because of that, it was considered as a problem. So they came up with a lot of myths like the hairy palms, the insanity, Yeah. But no, it does not cause blindness at all.
Actually, I was reading about a bit about masturbation over before this. I was reading a little bit about it, and I found out that apparently, Kellogg's cornflakes.
Yes, Kellogg's.
Right?
Yeah.
Yeah, that was actually created because they wanted to stop teenagers from masturbating.
How so?
Apparently, because it's plain and rough taste stops children from masturbating. Clearly, this was done in the 1800s, where scientific this thing was not as far ahead as we are now. But apparently, they believe that if you eat something that is very plain tasting and very coarse, it will stop you from masturbating. That was what they were going for.
But if they fortify the cereals with vitamin Bs, it actually boosts testosterone, making the libido enhanced. So, so it could be a dual effect here.
Okay.
Plain, maybe not, but fortified. Oh my God, I have to. So that way.
Okay. So if people want to masturbate more, get vitamin B in your body.
A lot of Bs, a lot of Ds, and we'll talk about the testo boosting ones later.
Okay. Vitamin D, if I'm not mistaken, is from the sun, right? So you have to
It is from the sun. Yes, it is from the sun. But after a certain age, you do not get the effects of vitamin D from the sun. So that's why we encourage vitamin D supplementation.
Okay.
A low dose. Well, sometimes when I say a low dose, it also depends on your healthcare provider whether they start at a lower dose or a higher dose. And but vitamin D also helps with sperm count.
Okay, I didn't know that. Okay, now here's a question that I'm sure many men out there would like to ask. How many times a day is it okay to masturbate?
Well, if you have 50 hours in a day, then you can masturbate more. But if you only have 24 hours, it only becomes excessive if it serves as an escape to problems in your relationship. So as long as it doesn't interfere with your relationship or your marriage or your work or your performance at work, and you do not have, the habituation that takes place, you're just thinking about only doing that becomes a problem. Otherwise, there's no number to it. You have time, if you want to release, go ahead.
So like if you're single and on a Sunday, nothing to do, just go for it.
Go for it. For as long as work done, job done, it doesn't interfere with your other activities.
I'm going to go out on a limb here and maybe just say, don't masturbate at work lah.
Oh, please don't.
Yeah.
No. That is a big no-no for everybody listening.
Just to show you both my hands. Right now I'm working, so
not at work, not at school. For those at school.
Yeah. Please don't do it in a public place lah. Do it privately in your house,
within your own four walls.
Another one.
Yeah.
Another question that I've always heard lah. This one is not. It's a little bit about men's health, but something that I want to know as well.
Right.
For certain sake lah. Is sperm good for the skin? Myth. It's not. So all these men have been lying to their girlfriends and wives all this time.
Yes.
No, no.
Yes, yes.
I sort of knew this. I sort of knew that was a myth because in the words of my friend Jonathan Atherton, who is a great comic in Australia, he always says that look, it is a myth because can you I and he can prove it to you, right? Because does this hand look any younger than this hand?
Nope, not at
No,
all.
no, it
No
looks the same.
difference.
If really this should be a hand of a 14-year-old, and
I mean,
you know what I
it
mean?
does contain all kinds of substances, but it
Ah,
doesn't apply to facial skin.
okay.
So, like we were to know that women's skin is different from men's skin. So, applying semen on your face has no effect
Okay.
on glow, on elasticity, on collagen, nothing whatsoever.
Nothing, huh?
Nothing
Okay.
whatsoever.
Okay, so yeah lah. So don't stop lying to your girlfriends. That's all I'm saying.
Well, do people do that?
Yeah. I
Okay.
mean, I not me. I'm very truthful. I
Ah,
tell them the truth.
okay.
Just saying.
Oh,
Okay.
yes.
Last question. Last question about masturbation.
Masturbation. Okay.
This one was something I heard as well. From especially from people when I was trying. Me and my wife were trying to get pregnant, right? And it's frequent masturbation causes low sperm count.
Well, low sperm count has many contributing factors, so it's not just about frequent masturbation or ejaculation. There are many factors to it. It can be hormonal levels, it can be your stress levels, it could be a metabolic disorder, it can
Mm,
even be your diet, what you eat. If you have a sedentary lifestyle, there can be
mm.
so many contributing factors. But no, it does not cause low sperm count, provided that you do not have all these other contributing factors.
Okay.
And in fact, there was a latest study saying that frequent ejaculation helps with risk of prostate cancer. Of course, it's
Oh,
still, yep, exactly. It's still in its early days, I would say, but they've come
okay.
up with this and they purported that it was a study in Britain, in London, saying that I'm just going to read it out. In fact, the latest study shows that the more you ejaculate, the less the chance of prostate cancer.
Okay. So I'm immortal lah, basically. Is
No, but like again,
no.
Kevin, there's so many other contributing factors to it. It's not just like if we're super fit and then it's a different story. Yeah.
Okay. Okay, here's a question, right? You
Yeah.
you mentioned being super fit helping with your well-being in a way,
Yeah.
right?
Hmm.
But however, I've known people who are gym junkies. They go to the gym. They're very fit. They're very clean. They're very this thing. But all of them, not all of them, like most of them, have some sort of underlying health problem. Like for instance, my brother,
Hmm.
right, who was a gym junkie. He used to lose a lot of weight and go to the not go to the gym as much, but he used to work out a lot and stuff like that. And also the fact that he passed away 14 years ago
Sorry.
on no worries. He had a heart attack, right?
How
And
old was he?
he was 29 years old. Now he was fit at that time,
Hmm.
although he was fat before, and then he went on this whole thing and lost weight and stuff like that, and he passed away. I, however, on the other hand, no regard of my well-being whatsoever, I'm okay. Like I just tested myself. I'm pretty much normal in all counts lah. Sugar, blood pressure, cholesterol, right? So does being healthy or going to the gym, working out, everything, does it affect your health?
Well, as for your brother or maybe others out there who've lost someone at a younger age, we cannot contribute it to being healthy as in being a gym junkie because there could be a lot of metabolic disorders that were unknown of. There could have been a clot that was sitting down there. There could have been cholesterol building up a plaque. There could have been diet that had affected his heart initially when he was bigger, because you mentioned that
Mhm.
he became a junkie, then only he became fit. But you must also
Yeah.
understand that whatever happens is from the day you're born. It
Okay.
is not that 6 months all of a sudden you're healthy. It could
Mm.
be your parents. Your parents make what you are. You are what you eat. And
Okay.
then there's also abuse of anabolic steroids for some people. They go to the
Okay.
gym, they're introduced to all kinds of steroids. They really
Mhm.
have to be careful with that because that can actually cause a clot, that can actually cause a cardiovascular event. So you have to understand there are a lot of contributing factors again. I use that word contributing factors a lot because not everybody is the same. I always tell my
Okay.
patients, no finger is the same. So it comes to that too. You
Okay.
have by right for healthy aging, do the exercise, eat the right food, drink the right amount of water, stay away from risk factors, make sure you know what your comorbids are. But you just
Okay.
don't know when he wants you, first of
Yeah.
all. You don't know how healthy your gene pool is. So there are a lot of factors to that.
Okay. All right. Now we move on to our bodies, right? We always hear this, right?
Mhm.
I just want to ask: is your hormones related to your race?
Is your hormones related to your race?
Okay, so let's say we always hear these stereotypes, right?
Yeah.
Where Indian people, they have BO,
Okay.
and Chinese people, they cannot grow a beard,
Okay.
or and so forth and so forth lah. I mean, there's a lot of stereotypes out there. Now, again, I'm not saying this is true or not. That's what we're trying to find out.
Yeah.
Is these hormonal things in your body related to your race? Is genetics available? A factor in this at all?
It is genetics, I would say, yes. It's your
Okay.
genetic makeup that causes you to have a certain kind of characteristics in a male. So Chinese characteristics are different, and Indian characteristics are different, Malay characteristics are different. Hair
Mhm.
distribution is different, but hair distribution is because of your family. If your father doesn't have much hair, the chance of you having thick hair is also very minimal, or for
Okay.
your mother for that. And then there's also sadly many researchers done that if you were to look at the three races, Indians are more predisposed to have central obesity, diabetes,
Okay.
hypertension, cholesterol problems, and even heart problems.
So I got
Man,
no hope lah in this life.
yeah. I mean, stay healthy lah.
Yeah lah.
And do it right. And do it right. That's what I would say. Yeah. So in that way, yes. But when
Mhm.
it comes to BO, body
Okay.
odor, there are many ways to perceive it. Do you know what is pheromones? They're chemical messengers
Yes.
released by
Yes.
men and women. Yes.
It's
Okay.
basically what makes me sexy.
Correct. Yeah. So there
Yes.
are also attractants and they're repellents. So some
Oh.
women are attracted to a certain kind of smell, and some women are repelled from that certain kind of smell. And this is all because of your gene pool.
Okay.
Okay. So
Okay.
some people would actually smell, some men would smell like vanilla, whereas
Mm-hmm.
some men would actually smell like urine or fish odor. But the
Okay.
fish odor is a mutation. It's because of a certain gene. That where you don't have
Okay.
that enzyme, you actually smell like fish. So in that way, I would say it's the gene pattern.
Okay. Because
Good
a lot of people used
hygiene.
to say I smell like mutton curry, but I
Okay, then
think
maybe you're just having a tad too much of spices lah.
okay.
Spices also release all kinds of smells. So that smells are the ones that say, "Hey, why? Oh, daddy ate pineapple. I smell sweet like a pineapple." No, actually, it doesn't happen that way.
Okay. Speaking of pineapple,
Ah,
I think you know where I'm going at this.
no,
Uh, no. Okay.
no.
Some people say, I don't know who these people are, but some people say if you drink pineapple juice, uh, your ejaculation will taste like pineapple juice.
Oh, as in sweeter.
Yes, apparently it tastes like pineapple juice. I don't know. I've never tried.
Well, there is a change in the flavors of any fluids that comes from the genitals based on your diet. Yes. So if you're going to have patai and durian,
Okay.
you can imagine. If you're
Okay.
going to have something very citrusy, then it'll be more acidic. If you're going to have something like vanilla, then you know lah what's going to happen. It'll be like vanilla cake.
Oh, okay.
But for
So
some,
this is
like again, for
so
some,
this myth is actually true.
for
So
some, yes,
okay.
but you must understand, if you have diabetes, then the smell is going to be different and the taste is going to be different. If you're going to have coexisting comorbids, it's going to be different. If you have a problem with your liver and your kidney, it's going to be different. So this myth is partially correct, I would say.
Okay. 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 Now we move on to a different topic, which is
Right.
hair, right?
Oh, okay.
Uh,
Crowning glory.
crowning glory. Something I don't know anything about. But also, okay. Here's the thing, though. I've had male pattern baldness since I was a kid, right? Since I
Okay.
was 21, actually, not a kid. But so the thing is, they always tell me, oh, no, the only reason you have this is because of testosterone. you have very high testosterone. That's why you are going bald. Is that true?
So who told you that?
My uncle
The
drunk
aunties and
in a
uncles.
aunties and uncles drunk in a family party.
Oh. Sometimes when they say when someone is drunk, we don't listen to what they say, lah.
No, you don't know my uncles and aunties. You have to listen.
You were sad. Okay, testosterone has been known to be a culprit for many, many, many symptoms. Sadly, testosterone has been shot down many times. We need to understand what is testosterone first. Okay, let me do a very simple biochemical talk about testosterone so men would understand what this is. Cholesterol. You know, cholesterol in the body, right? Doesn't mean that we need to have a lot of cholesterol, okay? Cholesterol converts through a process into testosterone. Now, testosterone is known as a sex hormone, sex steroid, androgen hormone. They're all the same names, the same thing. Testosterone converts to dihydrotestosterone, known as DHT. This conversion takes place because of a certain enzyme called the 5-alpha reductase. Okay, I call it alpha because males are like alphas. That's how I remember it. Now, is this conversion that causes the hair loss, the male pattern hair loss? It is the high DHT that causes it, not so much the testosterone. So it's very sad that when everyone shoots testosterone down, because testosterone is needed in good amounts, in optimal amounts, not in too high and too low, of course, for men's health, your muscle, your bone, your strength, your stamina, your endurance, your heart. It even helps osteoporosis. Okay, so when there's too much of DHT, known as dihydrotestosterone, which is converted by testosterone, that causes male pattern balding. Then you got many stages, like stage 1, stage 2, and onwards. But nothing to do with facial hair. There's no contributing factor. So you lose up here, but body still has hair, face still has hair. Okay. So sometimes some people say, oh, testosterone. I say, you have to understand there are two types. We've got the synthetic, and then we've got the natural sources, and then we've got the food. Okay, the food is separate lah. Okay, so if you're taking synthetic testosterone, there are more side effects to it because some abuse the steroid. There's a lot of abuse to it. But then, of course, there is also there could be problems in the brain. There'll be a gland there. If there's a problem there, it can release a certain amount of testosterone. It can reduce the certain amount of testosterone because we call it the feedback loop. Okay, so that's there too. Then testosterone is also converted to estrogen, estradiol, which is known as a female hormone. And that's caused by the enzyme aromatase. So there are so many reasons to why someone could be a certain size or how much of hair they have, but it's not actually just the testosterone.
Okay, so you are saying that men also have estrogen?
Yes. Like how women need a lot of estrogen, men need some estrogen. Just like how men have a lot of testosterone, women need testosterone too. For our skin, for our for our bones, for our libido, we need that.
Okay.
So yeah, we need both.
So is it true to say that if a person has too much estrogen, they become feminine?
They don't become feminine or effeminate unless they have a different genetic problem where there is a problem with the chromosome. Okay, I will not talk about that. That's not my department. But what happens is you form male, if I was to use the word breast here, called gynecomastia. You have belly fat, so your waist circumference enlarged. You have love handles. So these are all very feminine characteristics or features in a man when there's too much of estrogen.
Okay. All right. Interesting. Yes, because I actually have man boobs and love handles and belly fat, among other things that I have. But yeah, okay. So now, is there a cure or not? Like, okay, because they always say that, you can go to Yunnan Hair Center, they put some herbal towel on your head, then you'll grow back your hair, stuff like. Is there a cure for male pattern baldness for this DHT?
If you were to discuss with your healthcare provider or your healthcare practitioner, and they know how to block this DHT, there are many types of supplements or medication out there in the market, in the pharmacies especially, that what they do is they block, they inhibit the DHT. But you must also understand that there are always side effects to any medication.
Okay,
What I
and I've
what
read
I
the side effects. I've read
correct.
the side effects of
So
this,
you
which is
know the side
basically,
effects.
so basically, if you want to grow your hair, you take the medication,
Yeah,
but the medication side effects include lowering of sexual
and performance.
performance and all that lah. Basically, you don't want to have sex also. So if you want to grow your hair because you want to be more attractive, but when you achieve that goal, basically you don't want to anyway.
Exactly. So in my practice, what I do here is I compound a very specialized hairspray that blocks what's happening here, and it still
Hmm.
enhances your other testosterone levels in your body, giving you your muscle mass, reduction of belly fat,
Hmm.
your moods are better, your brain fog is gone, but it's only used for the scalp.
Okay, so
Of
it
course,
and it works. Like if you if or
it
like let's say in
works.
my case lah. In my case, I have this going on,
I mean, I
right?
can't see how bad your pattern is because it's all
Because
shaved.
it's shaved. I understand, but my pattern is basically patchy.
Okay.
It's what alopecia, I think it's called.
Alopecia is the word like balding, but there are many types
Yeah.
of alopecia. So androgenetic would be because of androgens, because of the hormones. Then there's also
Uh-huh.
ereta, which is more of an autoimmune disorder. So which one is that you have?
So even if okay, what I'm trying to say is even that it's this far ahead. Like I've been having it since I was 21 years old. I'm 40 years old now. It's been 20 years.
Okay.
So it still can save lah. That means.
We will have to look at your levels. When I say
Mm-hmm.
levels, I'm talking about testosterone levels. I'm talking about DHEA, which is, I call it the mother of hormones that
Okay.
converts to testosterone. I also will have to look at your hair follicles because there is this thing where there's a shrinking of the hair follicle. If it's dead,
Okay.
then there's nothing that's going to help. Lah. No spray can
Okay.
help unless you want to do
Okay.
hair
Okay.
transplant. Yeah.
Okay. So yeah, I like how this has become a personal
It's like, so this is
consultation
my
for
problem. Oh,
myself.
that's my problem.
No,
Okay.
no, it's fine. Okay. So and also another thing based on hair,
Yeah.
uh, a lot of people seem to think that somehow if you are very hairy, like
Right.
for instance, you have chest hair, your beard grows like mine, you have hairy ears and you have hairy back. Apparently, you are more virile. You are more, you know, yeah, more virile. Lah. That's the best word I can find. Other than that, I don't think I can say on life.
When you say thicker hair, is it facial hair, also scalp hair, or combination?
No, I don't think it's scalp hair. I think it's across the body. Like you're hairier.
Okay. Now, when you were to say hairier, it's more of a genetic play. So it's either your
Okay.
mother, father gives you thicker, coarser hair or
Mm-hmm.
fine, thin hair. So you notice some people have thicker hair and some people
Mm-hmm.
have fine hair. So that's one of the genetic predispositions. And the other one, of course, is partially testosterone. But thicker hair has got to do with pore size and
Okay.
follicle size. So the bigger the pore, the longer the follicle, the thicker and coarser the hair, especially in
Okay.
puberty. So like boys before they hit puberty, their hair is actually very fine. I mean, I have
Mm-hmm.
two boys and I saw the pattern. When they hit puberty, the hair gets coarser. But that's
Okay.
also because there's a surge of testosterone. There's a surge of DHT because that causes the male characteristics, deepening of the voice, muscle formation, distribution of hair. All right. But if I can say, what I would say is more gene and hormone dependent. So it's
Okay.
not so much about I got thick hair and I am more potent. No.
No. So basically, my hairy back means nothing, lah.
No, it's just your mother and your father, most likely your father.
No, trust me, it's most likely my mother.
Oh, your mother, are you?
Yeah.
All
Uh,
right.
yeah. So you alluded to this earlier. Like my ability to grow my beard is based on my testosterone. Is that true?
The conversion of DHT and testosterone, yes. So you'll have to look at your levels. When we were looking
Mm.
at levels, we don't just look at the total testosterone. There are two things that
Okay.
we have to look at. We have to look at the available testosterone that's in the body. We call it bioavailable. Because you must
Okay.
understand, testosterone doesn't just go freely in the body. It binds to certain kind of proteins like albumin. So there's a
Mm.
blood protein called albumin. It binds there. Then it's
Okay.
also another a binder called sex hormone binding globulin. We also call it SHBG, nothing to do with sex. It's just called a sex hormone. Okay. So that binds. So these two are your bioavailable. So whatever left in the system is known as free testosterone. So we
Okay.
need to know where your levels are. You can't just take a blood test and say, total testosterone normal what? No, we need to look at your free, what you have, and what your bioavailable is. And the sad thing with age is, with age, the sex hormone binding globulin goes up, leaving you with
Mm-hmm.
lesser testosterone. That's why people will have problems with um, uh, their erections, or maybe lower sperm count. There'll be a shrinkage of the testicles. There'll be a problem with muscle mass. There'll be a problem with balding. Hair will turn gray, will thin out, and all that.
Okay. So okay, let's move on to what I like to call the second puberty. Okay.
Okay.
Okay, so this is something that happens to a lot of men that I know. That basically after having the first puberty is when you're 14, 13, whatever lah.
Yeah. When you
Okay,
hit, yeah,
when you hit puberty, you know your voice start to drop. You know
change.
your change, and then you start growing facial hair. I remember when I was 12, I got caning in school because I grew a mustache. Like it's my fault.
Teachers, they just
I
don't
know it's
understand.
like it's my fault, Like I grew the mustache for this thing. Like I pasted like that. But now, it's okay. But for me, public caning in school like was like like a performance art like that because every day I
Dear Kevin.
can. But however, there is something called the second puberty where you reach a certain age, mostly middle age, and you start going through the same thing again. Hair starts growing in places that you never had hair before. Like for instance, for me, it was my back and my ears,
Did
right?
your father also have the same pattern?
Not really. I never. Okay, my father doesn't really have a lot of back hair. I do. Mm,
Okay.
Uh, Ear hair, like when I was young, when I was 20, 13, back smooth, nice, right? All it was nice. Like I didn't mind going shirtless. Suddenly, when I was 38, 39, suddenly back hair started growing. When did I become, Sivaji suddenly? Like, it just became weird. Like I was started growing back hair, and then my ears started growing, and I realized this when I went to the barber, and the barber asked me, Mau chuko ta? And I was like, no, I want to keep my beard. He said, no, not your beard, your ears.
Oh dear.
I'm like, what? And I found out, and it started growing longer and longer. So I had my ears, the outside of my ears, inside started growing out, that kind of stuff. And it's weird. Like for me, is this something that a lot of people go through? Like, the
there,
second puberty?
there are some who go through it, but all of a sudden they can form acnes,
Uh,
pimples. Okay, and
okay.
out of nowhere they'll have
Yeah,
acne on the back. Yeah, all right, on the
got,
arm, on the chest. Yeah.
got.
So what happens is testosterone starts fluctuating. It goes up,
Okay.
it goes down, it goes up, it goes down, because the body's preparing you for andropause. You must understand, like how women go through
Okay.
menopause, men also
Okay.
go through andropause. So
Oh, God.
yeah, God lah.
Ayo,
Sad to say, God
I
lah.
know.
Yeah. Anyway, we'll talk about that some other time. So when there is this fluctuating of all that, and that messes the dihydrotestosterone, like I mentioned, okay, that
Okay.
causes acne, that causes coarse hair, or that causes all of a sudden that pore never existed and there's a pop of hair there. So
Yeah.
that can happen, but not to everybody. Not to
Okay.
everybody. And sometimes there'll be a change in the male genitalia in size, in shape, like how you mentioned the brothers, right?
Mm-hmm.
Then you also notice some people there'll be a sagging of the testicles. So all that can
Uh-huh.
also happen with
Okay.
age.
Wait. I need to know why does the testicle sag? Like why is it when the older you get, the lower it gets? Like you see an 80-year-old man, like his testicles are coming off his long pants. Why does this happen?
Well, gravity.
Okay.
Cheek sag, eyelid sag,
Okay.
breast sag, so does the testicles. So it sits on a sac, right? It's
Right.
just skin. So when you lose collagen and elastin, it
Mm-hmm.
sags. Anything, the whole body, everything, arm, everything sags. Even the thigh in between, everything sags. That's one. And the second one is there is a muscle that holds everything intact down there for men called the cremaster muscle that also elongates and sags with time. So that's
Okay.
why it tends to go downwards.
Okay.
So, there is actually a term called the splash test. Have you ever heard of the splash test?
No.
when you sit in a bathtub or at what are the
In
spa
the
areas, something
okay.
hits for your glutes, your buttocks. So it's called the
Okay.
splash test. And
Ah.
the reason God has made it such that the reason that the some of how do I say the testicles are further away from the body is because of the core body temperature. It cannot be kept too much too hot because it hinders with sperm production.
Yeah.
Mm.
That I mean that we know lah. Okay.
Yeah.
Here's one more thing. Why
Yes.
does one hang lower than the other? Is that normal?
Oh, that's normal. I notice in women that one breast is higher than the other. And also,
Okay.
when I do examinations of men, I also notice that one testicle is higher than the other. That's just because of the cord, the way it's put.
Mm-hmm.
It's
Okay.
some people have even got one leg longer, one hand longer, and that's
Okay.
some have it, some don't. But if you're going to be wearing boxers all throughout, then you're having what you call it let loose, then the
Mm-hmm.
chances of you having it longer and saggier is imminent.
Okay. Because I wear boxes.
Yeah.
Yeah.
Keep it
Okay.
firmly secured. Not too
Okay.
tight, not too loose.
Okay. No lah. I cannot go back to Y France anymore. It's a lifestyle choice,
But there is
which now
no,
I.
they have a tighter boxer, not so tight, not so
Oh no,
loose.
yeah, I use the boxer briefs lah, so that's okay,
Ah,
right?
okay, yeah, that's fine,
Uh,
that's fine.
okay, thank God. Uh, okay, so now I want to ask about skincare products and stuff like that,
Right.
right?
Okay,
And
skincare.
yeah, so it's one of those things where we men seems to think that skincare products. In fact, even up to the sunscreen stuff like
Mm.
that, SPF 40, 50. We don't need it. We're men, right?
Wrong. You need it.
Okay.
Every man out
Okay.
there starting from puberty, or maybe boys starting from puberty, need a proper skincare. You do not need to be elaborate, have 10 serums, 20 anti-wrinkle creams and all that.
Uh,
But you need to have a very good cleanser based on
okay.
your, I would say, sebum distribution. So if your skin is very oily, get something that's more for oily skin. If your skin is very sensitive, get one for sensitive skin. But you do not need to get something so elaborate. A very simple, gentle cleanser, and make sure it's antibacterial if you're very prone to shaving as often as every day. So, antibacterial cleanser will help you with your pores not to form bacteria. That's one. You do not need a toner. You don't need a mask. You can actually scrub twice a week. Too much of scrubbing irritates the skin, especially for men who shave. When you shave,
Mm-hmm.
you remove the protective layer of the skin, so you really have to take care of it. You got to balance back the pH. You've got to
Right.
fix it back, I would say.
Okay.
Moisturizers, again, a simple moisturizer. Just if you're having T-zone problems, like some women have T-zone. What I notice about men and women, their skin thickness is different. 25% more in men with thickness of skin than women. That's
Okay.
why women need more products because we sag faster. Men,
Okay.
thanks to testosterone, don't sag as much. But the reason that you all have more wrinkles than women is because of facial expressions. Men tend to do more facial expressions than women. So the first thing that sags in a man are the eyelids. This
Okay.
goes down first. Yeah. Okay. So you've got your pH too. The pH is different in men and women. The pore size is different. The sebum production in a man and woman is different. Women more on the forehead. That's why you always see this is shiny. Men on the
Mm-hmm.
cheeks. So that's why there's more acne or pimple formation on the cheeks. So
Right.
yes, I do agree with a very simple, basic skincare regime based on your skin texture and your condition. The more you shave, the more antibacterial you get. And remember, please, men out there, when you're shaving, how deep you go, how firm you go onto the skin, how blunt your razor blade is, all depends, and that actually destroys the skin layer. So you're more
Okay.
inflamed, there'll be pigmentation because it's always that sit here, pull down, sit here, pull down, so you get pigmentation there. So the skin
Uh,
gets closer.
is it the same with the scalp as well? Because I shave my scalp.
What I notice, I think with skin, we tend to do this. Scalp, we're like more gentle.
Yeah. I am very gentle with my scalp because I obviously don't shave my
Yeah,
beard,
I
but
can see
however
that.
I shave my scalp quite often. But I do have I mean I do still get cuts though. Like sometimes I take off a whole chunk of my
So,
skin.
do you not use a shaving foam? blunt
No, I mean,
shaving razor, perhaps?
I basically it's the I mean I use a safety razor, the one with
Okay.
the three blades, but
Yeah.
also the fact that I use mostly water and soap. I don't use shaving foam
Why not?
because lazy.
Okay, then more nicks lah, and more cuts.
No, I mean no, I don't usually get a lot of cuts, but sometimes when there is a bump on my scalp
Ah, yeah,
and
yeah.
I
Then you
don't
cut
notice,
that.
then pop, yeah,
Yeah,
then
that might help.
basically
Just
yeah.
antiseptic will do. Yeah.
Yes. Okay. Now, okay. The myth is the reason why people don't wear, skincare or whatever is because apparently the male's skin is thicker and more resilient because they have, apparently, is that true?
It is thicker.
Okay.
It is thicker by 25%, like I mentioned earlier, with women's skin and men's skin. And the
Uh-huh.
fact that you have more testosterone, your skin is actually more firmer and stronger.
Okay.
But when you talk about resilience, if you're the kind that don't shave and don't destroy the layer, then yes, your skin is resilient. But if you're always doing something and inflaming the skin, then your skin
Mm.
becomes thinner and thinner. Oh, sorry, thicker and coarser in that area. And of course, the
Okay.
skin care is warranted.
Okay. All right. So now we move on to my favorite subject, like food, right?
Food.
Because food myths, there's a lot of food myths. Like, for instance, there are some, apparently there's some foods that, like mint, for instance, mint or
Ah,
menthol.
mint.
Okay, actually this is not food, but this is something I've heard a lot of times, right? Menthol cigarettes and stuff like that causes infertility. Like, basically you cannot use anymore.
Well, what I notice about, I mean, I'm going to just divert a bit. Kids in school, they always are chewing mint. It's either a spearmint or some
Mm.
peppermint. I don't see them having a problem with their testosterone. That's one.
Yeah.
Okay. But there
Okay.
is a study that says that it reduces androgens. Yes.
Okay.
But there is no impact on testosterone. So it has no impact on fertility whatsoever.
So
Based
mint
on studies
reduces estrogen, androgen,
androgen androgen
androgen.
but the statement can be made controversial here. It says one of the studies says that it reduces androgens, but it has no impact on testosterone. So it could
Okay.
be reducing a different kind of androgen, but not the testosterone per se.
Okay.
So it has no impact on low sperm count, infertility, impotence, nothing whatsoever.
Okay. So, what about foods like, that are meant to be aphrodisiac, right? Like for oysters. Apparently, if you eat oysters, suddenly you feel like, oysters.
For men and women.
I don't know, like oxtail soup. This one I know from very Malaysian oxtail soup. You drink oxtail soup, then you like putting lead in the pencil. That's the quote.
Actually, it's not
Uh,
a certain dish or a certain inert or certain animal part or anything of that sort. It is zinc.
okay,
Zinc as a supplement is an aphrodisiac. So any food that contains high levels of zinc, like oysters, yes. Sorry about this.
it's okay.
Sorry. Yeah. Um, so anything that has high levels of zinc would be your
Okay,
aphrodisiac. So you're not like a dead slug.
okay. So it's
Yeah.
zinc.
Zinc.
So, okay, have you heard of
Oysters.
soup? Okay,
Sorry.
oysters is one, but have you
Yeah.
heard of soup torpedo or not?
I've heard of it as how people speak about it, but I don't know the
Okay,
impact of it on the genitals or on the
okay.
testosterone.
Okay, so
Yeah.
for people who don't know, soup torpedo is basically the soup made out of, it's like a soup kambing, the base,
Yeah.
made out of the bull's penis. Basically, they cut
It,
it out
is it the penis or
and
is it testicles? Penis.
no penis.
Oh,
Trust me,
okay.
I've
All
had
right.
it.
Okay.
It wasn't a very how do you say, pleasant taste. No, okay, actually, you know what? The taste doesn't. It's no different than having tendons, for instance. But
Correct.
however, the look of it, is just very daunting. It's very daunting
Not
to
not
look at something.
appetizing.
Yeah, it's something to look. You're eating something you have. You understand what I'm saying? It just,
Right.
and it looks like that. You know it is like you. It's not even dressed up, dice. Small so that you don't see. No, it's there. It's, although it's sliced, but you can see the cut, and it's. But yeah, it didn't do anything. Basically, I didn't feel any different.
Exactly. So there are a lot of urban legends
Mm.
about having animal parts. In some parts of the world,
Yes.
there is, I don't know, tiger testicles. There
Yes.
is goat horns. Now there's a new one called honey goat and honey wheat and something of that sort.
Yes.
I
Okay.
don't see any effects in anything. Yeah, I don't
I
see
just wa-
medically. It
I
doesn't alter your levels. It doesn't have anything to do with any part. No. Yeah.
no, I just want to find out who was the first person who thought eating a tiger's balls or penis would be a good idea. They saw a tiger and they said, "I want to catch that tiger, and I want to cut off its private parts and I want to eat it." Like,
Maybe when they looked at the animal, they looked at its vigor, looked at its stamina. So they I will not use the word assume. They thought that eating an animal's testicles will have the same effect on a human. We're not the same gene code. We're not the
yeah,
same structure. This is
like
different.
rhino horn, for instance, is something that,
Yeah.
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 And
So
I read up on this. This
eat
rhino
the
horn is
rhino for the
basically the
horn.
same. Is same as your nails.
Correct. It's just
Yeah,
thick, thick, thick nails.
yeah. So I mean, I chew my nails all the time, so it didn't. It doesn't help, lah. That's all I'm saying.
Testosterone boosting foods can be like tuna, salmon,
Okay.
omega
Okay.
3. We've got, what else is there? Beef, beans, shellfish, ginger, onions, even bananas, because banana contains bromelain, which is an
Okay.
anti-inflammatory. So these are known as testo boosting foods. But whether they're going to increase your testosterone levels after a certain age, they're still controversial because you will need a certain amount of testosterone to maintain your
Mm,
manliness, your manhood, and your man levels. Okay.
okay.
As in food that reduces testosterone, I've heard on research, of course, licorice, or some people say licorice, licorice root,
Hmm.
soya-based products, because it does, some people say it contains a certain kind of estrogen, flaxseed, alcohol, of course, alcohol.
Okay.
We're not going to talk much
Okay.
about alcohol because it can be, a bit of a sticky subject.
Yeah.
Processed food, fast food, any processed meat for the matter. Yeah.
Okay. That all increases your testosterone.
Lowers.
Oh,
The increase
lowest. Okay.
other one just
So
now talk
wait,
about, yeah.
soya bean reduces your testosterone. Because
There are still
I've heard that there is a myth that if you drink soya bean, your sperm count is better. There
really
is a
no
myth.
no.
Yeah, this is something.
I
This
shall
is some,
research on that myth.
no. This is some. Oh, clearly, this is not a medical myth. Obviously, this
Yeah,
is something that
yeah.
your uncles and aunties talk about. Apparently, if you got low sperm count, you drink soya bean, you'll be fine.
I normally advise my patients who come to me when they have a
Hmm.
problem um, with their impotence or their erectile dysfunction. When I look at levels, I also look at the estrogen levels, and I do advise them. I don't force them, of course,
Because-
to cut down on soy products because there is a conversion into phytoestrogen, which is a female hormone. Too much of it,
Okay.
obviously, is going to have problems. Yeah.
Okay. So I think we've covered most of the questions that I had.
Right.
Now we can go on to the Q&A, where basically we will come to there's a lot of people who asked a lot of questions in the chat. Like, for instance, wait, let me find.
Okay.
Uh, Most of them are saying, okay, yeah. Joshua says, how does antidepressants react to DHT?
Antidepressants can, for some, depending on what kind of antidepressant or any other form of medication, can increase DHT.
Okay.
DHT, sorry, can increase DHT, taking away the natural testosterone that you have in your body, leading to some form of erectile dysfunction or impotence or low libido.
Okay.
Yeah.
Here's something related to this as well. The fact that the myth is that men are more susceptible to go through depression than women.
I believe both genders, depending on the stress levels, depending
Mm.
on the situation. It could be physical, it could be emotional, it could be work related, it could even be genetic, of course. But when your testosterone level does go down, eventually after the age of 40, it
Mm-hmm.
does play an important role in your moods.
Okay.
Some people feel that blue.
Right.
I feel blue, I feel down. I do have some patients who've come to me saying that they have these mood swings, not so much like a woman's mood swing, but like irritability, anger, aggression, loss of focus, loss of concentration, brain fog, maybe. Yeah. So when we give them a very small dose of I mean, I work with bioidenticals. When I give them a very small dose of bioidentical just to optimize their levels, I see that mood change.
Okay.
As for women, there can be so many other contributing factors again. It can be menopausal, it can be pubertal, it can be during their periods or before their periods, it can be a problem in the marriage, it can be a problem at work. So we can't say one gender has more chances of depression. No, we can't do that. Yeah.
Okay. So it's one of those things where basically it's
So
not.
many factors.
Yeah.
Yeah.
I mean,
Multifactorial.
depression is a hormonal thing. I mean, it is this thing, but it doesn't matter.
Part. Yeah.
Man or woman. Yeah. Okay. Fine. Uh, Next question we have. Uh, I have to say, a lot of people are saying that good job, Dr. Sharan, and stuff like
Thank you.
that. Yeah. So,
Thank
Joshua,
you.
again, what
Yep.
is the
The main
what is the
cause.
main cause of graying in men, and is it possible to slow it down?
The main cause of graying in men is just your reduction of testosterone and the process of aging. If you were to take your age and minus it by 100, that would be usually roughly the levels that you have in your body as your testosterone. So if you're 50, you've only got about 50%. So graying happens. There is no product out there or supplement that helps with graying, because I'll probably be the first. Then I don't have to color my roots every 3 weeks. Right? But if you were to possibly slow down or reverse aging, not just the graying part, then what we can do is optimizing your hormone levels. When I say hormone levels, I'm not just talking about testosterone. We're looking at your
Mhm.
thyroids, we're looking at your DHEA, we're looking at your FSH, your LH. There's so much to it. It's not just one hormone that makes you a person. There's so many. I call it the five army, the five gang
Okay.
member. If you want to say, if you're missing a gang member, then you really can't fight your body. So you've got your
Okay.
testosterone, you've got your DHEA, you've got your thyroids, you've got your stress hormone called cortisol,
Hmm.
and then you also have your FSH and LH. So you need to look at all these hormone levels to see whether you can slow it down or reverse it. But of course, if your parents had young age graying, premature graying, then you're in that boat, man.
Okay. We have a question here from Ong Luk Kin that says, "What is the suitable medicine for stage 4 of prostate cancer? I did have a minor surgery for the testing for 1 year 1 year ago. No medicine is given. My PSA is 2.87 2 months ago result. After the surgery so far, no need for hormone therapy according to the doctor, and I'm age of 70. I am very fine and go back to normal so far. Any suggestions for me? What type of food is not suitable for my case?"
Thank you for that question. I would not be able to answer what suitable medication is there for stage 4 prostate cancer. That would be your oncologist telling you what to take, what not to take. I'm glad that your PSA has become a level of 2.8. I am so happy that you're fine and you're able to go back to normalcy. Being 70, you probably would be having some form of muscle mass issues. I mean, I don't know energy levels, but then of course you cannot take testosterone because there are a lot of studies about testosterone and prostate cancer, so we don't want to touch on that for today. And maybe looking at your thyroid levels to help you can help you with that. But as of suitable medication for stage 4 prostate cancer, I'm so sorry, I will not be able to give you advice on that. So sorry.
Okay.
What was the
We have another question here from Lo that says, "How will the removal of the prostate due to early prostate cancer affect men in terms of hormones, erectile dysfunction, and other aspects?" That's first question. Then we go on to the second question after this.
Okay, so if you were to remove the prostate, now the prostate only produces a certain kind of fluid that joins with the semen for ejaculation. So if you do
Mm.
not have an issue with wanting to have a child, then I don't see the reason you need to have your prostate with you, because if, you don't need to have the sperm production, then it doesn't matter.
Okay.
But as of erectile dysfunction, again, a very controversial statement or question. Well, you have to talk to your healthcare provider or the doctor that you're seeing or the specialist that you're seeing, and maybe that doctor will be able to give you better advice. Or
Okay.
come see me now, then we can discuss it further.
Okay.
Should
The
men?
question number: Should
Oh,
men
sorry.
make efforts to reduce testosterone level in order to decrease chances of reoccurrence of prostate cancer?
Now, in the early years, there was a lot of research saying that it's testosterone that causes prostate cancer. But after many researchers, it's actually DHT.
Okay.
Okay, so you really have to speak with your doctor, the one that's treating you, or you can always come back to us about this, and we will look at your levels to see whether it's the DHT is causing it or whether it's the testosterone. I don't advise my patients to reduce their testosterone levels if they do not have active prostate cancer. If they have active prostate cancer, please do not touch testosterone. Too controversial. Too controversial, and but you can enhance it other ways. You don't have to give testosterone per se, but you can enhance your levels with DHEA, not just
Okay.
testosterone. Yeah.
All right. And question number three: is there no nerve spared during the prostate removal, and what can men do to regain erectile functionality?
Again, speak with your urologist.
Right.
Um, I won't be able to answer this because I don't know what the doctor's going to be doing for you, what they're going to be removing, whether there's going to be damage for some reason. Please speak with your doctor. Yeah.
Okay.
I
How? Okay. Here's the thing, though. I mean, we're speaking of prostates and stuff like that, and we all know how to do a prostate check,
yeah.
right? How it's done actually. The fact that, look, there's a lot of people who are not comfortable with that method. Is there any other method to do it?
When a doctor does a digital rectal examination, where they actually
Okay.
do have to insert two fingers into the rectum to look at the border of the prostate. But mind you, when you do that, you're only looking at the posterior border, which is the back border of the prostate. The
Mm.
prostate has a anterior, the front, and the posterior, the back. I would suggest that if you're uncomfortable with this, doing an ultrasound.
Okay. So that is possible.
Helps. Yes, it is. Look at your PSA levels. Make sure that if you have any abnormalities or irregularities in your urine output or the way you urinate, or whether
Mhm.
there's an ejaculation problem, or whether there's all of a sudden there is a problem downstairs, let's just say, get your doctors to check you. Do your annual examinations, do your blood tests, look at your PSA levels, and look at your ultrasounds. It does help because I know some of us do not like to be probed or prodded the wrong way. I understand
Mm.
that we do not force, doctors don't force a patient to go through a digital rectal examination. Ultrasound is also good enough.
Okay. I mean, I've been through once. This was a few years ago. It was
Ouch.
very traumatic for me a little bit. I think. Also, the fact that the worst part was the doctor was it was a family doctor, and I've known the doctor since I was a kid, and it was very difficult when the doctor is trying to have a conversation with you while his fingers up there, and he's like, how's your father, which is the closest thing to who's your daddy in
Oh
that
dear.
possible time. Yeah. So yeah lah, just make sure you're comfortable with your doctor, I guess.
Yes.
Okay.
Yeah.
Here's the thing: the medical checkup, right?
Oh yeah.
Uh, how often do we need to go for a medical checkup?
Yearly, if you have no problems.
Okay.
But as soon as you find that there's a problem with your body in any form, get it
Mhm.
tested and get it checked. Please don't wait. The problem with us humans is we wait. Some of us
Mm.
procrastinate. Some of us think that Allah, it doesn't happen to us. No, get yourself checked. My patients are as young as 20, 25. They come, they check because you don't know who can get cancer at what age anymore.
Right.
I mean,
Uh,
that's one of the
if,
preventions you want to do.
what kind of test? Like, okay, you can walk into any clinic and say, I want to do a blood test,
Yeah. So
and
yeah, you can. So there are some patients who say, I want to come for general screening. Then we
okay.
ask them, what do you mean as general screening? Are you looking at just physical examination or are you looking to do some blood work? So then they say, oh, why don't you advise me, doctor? So I say, we could always do a general blood test, but then I would have to ask you a series of questions. So the questions would be, now, what does your mother and father have? What are your risk factors? How much you smoke? How much you drink? Do you have any drug abuse? Anybody in the family has cancers? What kind of cancers you have? What kind of food diet do you have? What kind of exercise do you do? Are you sedentary? Are you inactive? With all these questions that we ask, of course, my series of questions can be about like 10 pages long because I
Okay.
am OCD. And then we give you a A module, okay. We can do an ultrasound for your prostate and your bladder. We'll do a series of blood tests to look at your tumor markers, your general, like your liver, your kidney, your sugar, your cholesterol levels, your your urine and all that. And then we add on hormone levels if the patient requires some form of hormone intervention.
Okay.
That's how it
It,
is, yeah.
is it expensive to do a medical screening?
The more you add, the price goes up. If you're doing just the basic, it can be between 100 to 200 ringgit. But depending
Okay.
on where you go and how many tests are done, of course, the
Okay.
more you add, then the prices go up to 200, 300, 400. If you're doing hormones, hormones are rather expensive. It can go as low as 500 all the way up to 1,500, 2,000. So it depends on what you're doing. What kind
Okay.
of test?
Can I say the minimum of
100.
of no, I mean not the price.
Oh,
I'm saying
okay, sorry.
the minimum that you should do every year at what age? Like for instance, for me 40, what is the minimum I should do?
Oh, definitely a general screening blood test.
Okay.
Okay. Then we're going to look at your weight. When we're looking at your weight, we're looking at your muscle mass, we're looking at your visceral fat, we're looking at your skeletal muscle, we're looking at your water. And then we'll
Okay.
always ask you to do some tumor markers, depending. And looking at your male pattern baldness, I would definitely want to do your hormone levels.
Okay.
I would
All
also
right.
want to do your thyroid levels to see why you're sluggish. I will want to make sure that you don't have insulin resistance that can lead to diabetes.
What makes you think I'm sluggish?
Oh,
I'm
no, no.
actually quite quick. No,
To
I'm just
make
kidding.
sure you're not sluggish.
I'm not.
Yeah.
I'm just kidding.
Yeah.
But yeah, thank you very
But,
much, Dr.
but
Sharan.
when I
I
say
think
the word sluggish here, I'm not talking about you being sluggish. Your thyroid's being sluggish. The
yes.
levels. Yeah. So sorry about
Yeah.
that.
No, of course not. But yeah, thank you very much, Dr. Sharan. I think that's all we have time for today.
Thank
Thank you so
you.
much
Thank
for
you very
answering the
much.
questions and the busting most of the myths that I've come up with. So the moral of the story, if anything you can take out of this, is stop listening to your uncle who's not a doctor.
And
If
go
you're
to a
if
real doctor.
yes, unless your uncle is a doctor, then listen to him,
Yes,
right?
then
That's
go
that's the
ahead.
only
Yeah,
thing.
definitely.
Here's one thing that I've always heard: is laughter the best medicine?
It is. I agree.
It is.
Every day. Yes, it is.
No,
Because
because
it increases the dose of happiness, your dopamine, your
okay.
oxytocin, your serotonin, your endorphins. So
So
that makes
yes.
you happy.
So go to a comedy show when it's open again, lah. When
Oh,
we get to
yes,
open again,
please. Oh, I can't
go to
wait.
a comedy show. Yes, and also the fact that if unless okay, laughter is the best medicine. I have to agree. But however, if you have a rash, don't laugh at your rash. Just go to a doctor.
And if you have stress, please fix that too.
Ah, yeah lah.
I would like to do a take-home message for everyone who's viewing.
Okay.
I like to do mnemonics. So since we're talking about men, I would do the mnemonic of testo, T-E-S-T-O. So the T would be for train and tone. Exercise, men, please exercise. It's not just about running a marathon. You also have to do resistance training or HIIT, high intensity interval training. Eat right. Have a balanced meal of your proteins, a little bit of carbs, and a little bit of fats. Sleep more, stress less. I'm not going to talk about smoking, but otherwise it's smoke less. Have the right supplements, and of course, cut down on your sugar and your salt. Treat whatever problems you have. See a doctor. If not a doctor, please don't go and ask your friend to solve your problem, because if it's medical, you should actually see a healthcare provider. And the others will be check your levels, make sure that you're not having any forms of metabolic disorders or insulin resistance that can actually mess up your testosterone. And stay safe
All
during
right.
the COVID
Thank you very
era.
much.
Thank you
Thank you
very
very
much.
much.
Thank you. Thank you,
Good
Kavin.
afternoon and thank you. Bye.
Thank you. Bye.